What do you mean?
We're live now.
PG.
Whole world is gonna see that.
It's supposed to be PG.
Well, you know, definitely should be G or PG. Should be in that range. Hopefully this microphone's working. Maybe if we could actually get some people up in here who could hit this video up, ask questions, or
No, wearing your watch.
no, I'm not wearing my watch. I had my watch on for work, and then I took it off when I came home off of work. It's usually how that goes. It's all sweaty. You can see right there. I got like these little zits from where that got all sweaty. I have no idea if anyone's gonna show up or they want to hear us talk about this. Is that bothering you? Here, let's tilt. Is that better? You just want to be in the center of the shot, don't you?
No, I think that's like even.
That's even, yeah. It's kind of off, but that's fine. But like I'm closer, or we just pull it to the side, like that. That's better.
Yeah, I think so.
Okay. Okay. So, hey, there was somebody there and then they left.
Looking rough, man.
Yeah, man. If they could tell me if the microphone's working, that'd be great. That would be.
Have you done this before?
Well, I did this for Josephine's birthday party one time, and I think you could hear through. I think this should pick up the microphone and everything on it, so that should work fine.
Yeah.
Hey, if you could see us here, who's ever that is, it doesn't. Why isn't? I thought it's supposed to tell you who joins.
I thought so too.
I thought it's supposed to be like it's supposed to come up and say who joins, right?
Finish.
No, I mean, I hit finished.
No, I was telling you to hit finish.
Oh, to hit finish. I was like, I don't think I hit finish.
Maybe because like you're still in the editing. Like maybe.
No, I don't. Ooh, no, I don't. I think that'll end it. Because it's up there. It shows 2 people, which makes me think 2 people are watching.
Yeah.
Which means if I hit finish, it'll end, right? Probably.
Recording? Or?
I don't know. Can someone post something here? Let me know if this is working. The microphone's working and everything's working. I see 2 people watching. So you 2 people, someone could post, say yes, we can hear you, or something along those lines. That'd be great. But what we wanted to see, I don't know if I want to go on and explain what we're going to talk about and what's going to happen if I don't know if people can hear us. It says comments will appear here, but no one's commenting. Does that mean there's not a good connection? No, there's a good connection.
These are just random strangers.
I don't know. So, tab here to invite.
Oh, view your broadcast, yeah.
Wait. Can you hear us? I feel like this is a really dull. Okay, perfect. Okay, so awesome. Hey, oh, there it goes. It's working now. It's working now. Hey guys, appreciate you stopping in for a minute and to listen to me, TJ, talk about what's coming up. So TJ and I both went to our pre-op, and it went well. So TJ did his, and TJ flew in yesterday from Texas, and then he drove straight from Louisville Airport to Lexington, where he stayed at his hotel. Hey, what's up? What's up, Dakota? Thanks, man. Thanks for checking us out. But he drove from Louisville to Lexington. He stayed the night there, and in the morning he did his pre-op. And then I went later that afternoon. My pre-op was from 1 to 4. So TJ, why don't you tell us how your pre-op went?
It was good. It was easy. Really, I'm a healthy patient, so
yeah, I mean,
they're really not concerned about anything. I didn't have to see with the anesthesiologist. Just pretty much did the lab work and talked to all the specialties. Like the lab work was all drawn, and then talk to the doctor, the surgeon that's going to be performing the procedure, the dietitian, and the pharmacist, and the donor coordinator. That was pretty much it.
So they didn't have me talk to the dietitian or the pharmacist. What did you have to talk to a dietitian or a pharmacist about?
They were just saying, like, you know, how, like, your life, transitioning to your life, like, being with one kidney, like, it shouldn't affect you too much, but there's a lot of lifestyle changes. Like, she was like, you pretty much have to cut, like, salt out of your diet from now on, and just also, like, too much not, you know, staying super hydrated. Your lifestyle choices and such as exercise, nutrition are going to be, like, super important for the longevity of your kidney, and just kind of, like, the way that you're going to have to change the way that you, like, handle that.
Do you have a higher likelihood of you getting kidney disease?
I mean, so that's always been yeah, so that's like the first thing that they said, like, with the coordinator, that, like, with you living one kidney, it's going to put more strain on your one kidney, and that it is going to, like, increase your, you know, your chances of getting CKD later on in life. But the good thing about it, I mean, yeah, I don't know. I've already, like, accepted it, and it's something that, you know, I've already decided, you know, sealed my fate. But the cool thing is,
you can still change your mind at any moment. You know that, right?
Yeah, no.
You could be on the table and be like, I would change my mind, and I would have no hard feelings about it. You know that, right?
I know. But,
okay.
But,
like, I mean, I really do appreciate it, but if I don't have to take your kidney, I wouldn't. But I do appreciate you. But you can change your mind, TJ, is what I'm saying.
I know.
And I promise you, I wouldn't have any hard feelings towards you, man.
It's okay.
No.
I wouldn't, like I said, I wouldn't give you any, like, false hope with that or anything, but it's something I've already decided, and it's not, like, too, like, so in my situation, since I'll be having, like, one kidney for the rest of my life, that, like, with that being that a higher chance of me getting that illness, I'm going to be on the first on a donor list. So instead of having to wait, like, on a donor list, I would just automatically be moved up to the very top.
So the pro side of giving away your kidney is you're the first one to get a kidney?
Yeah.
That's awesome.
It's kind of like, it is
because I can't pay you back.
Yeah.
There's no way. I can't pull out my one kidney to give it back to you. I mean, I don't think I could. And I would die.
Yeah. And I mean, I got, like, superstar kidneys, so, I mean...
They said you have superstar kidneys?
Yeah, like, I had, like, 20 points, like, higher than the average filtration rate for their kidney. So,
oh, yeah. Wow.
So they're like, when you have, like, amazing kidneys, they're like, yeah, you have really good kidneys. Yeah. But, so, that's good.
So what...
And they were, like, a little bit larger than normal, too. So.
Oh, were they?
Yeah, which they were saying that's good, since they are, like, a little bit larger than normal, and they have a higher filtration rate. My body should be able to compensate a lot easier. And since I am younger, that my kidneys will actually probably even grow, like, even larger.
So potentially your kidney inside me could get bigger and filter better?
Yeah, probably.
Oh, that's good.
Because that's what's going to happen to mine. So
it's going to get larger.
Mm-hmm. And it says your body's going to try to compensate, because I'll be compensating with one kidney, and you'll be compensating with a good kidney. So I've heard from other people too that typically, like, the recipient, like, has, like, a better time recovering than the donor, because, you know, the recipient's getting something in need and the donor is, like, losing it. So if that makes sense.
Yeah.
Yeah. So, like, my body will be, like, compensating up for a little bit, but it'll be fine.
Okay. Yeah. So what did the pharmacist have to say? Why did you have to talk to a pharmacist?
Because, like, talking about, like, living, like, long term, like, there's certain things in, like, your diet too. So I guess that's more of a dietitian. The pharmacy was just more like, hey, there's certain drugs that you have to, like, keep in mind that you have to only have one kidney, and make sure you, like, tell, like, all of your future care providers that you only have one kidney, because a lot of the drugs are, like, super straining. They strain a lot on, like, your kidneys.
So you're gonna have to stay away from, like, NSAIDs and things like that.
Yeah, well, not necessarily NSAIDs, but, like, definitely ibuprofen and anything with, like, Motrin, like, any of that stuff.
Because it's really hard on your kidneys, right?
Yeah, they said.
I mean, that's what they told me
Tylenol.
when I first got kidney disease. They said, stay away from NSAIDs, stay away from Motrin.
Yeah.
Only use Tylenol. Try to not use it that much.
And that's what they're pretty much telling me too.
So. Oh man. Yeah. So yeah, that's rough, man.
And that's what it is. So. But even with like that, so like even with that, like so like you're what like someone in the kidney like donor position that needs a recipient, like your GCF or whatever. Like
GFR,
yeah. GFR is like 15, right?
No, my GFR is 12.
Yeah, like so that's even worse.
Yeah.
So like they say like you get put on dialysis when you're like less than 20. Like Todd, the coordinator, has been like super informative with me, like telling me about it and how it works, and not only like for the recipient but the donor, and also like what like quantitative, what are the lab work that you're looking at. So
this is actually like a God thing too. I mean, this is you too,
yeah.
but it's because I was told my nephrologist. I actually when I found out TJ was donating, and then the day after I met with my nephrologist, and my nephrologist said, based on my potassium and my GFR levels, that I was going to need to look into doing dialysis soon. So probably within the next month, I would need to be starting peritoneal dialysis. And so they were talking about setting me up, getting the tube placed in my stomach. But she said, because I told her, I was like, well, we already have a date for. She's like, well, don't worry about any of that. She actually wanted me to get on a bunch of different drugs because my phosphorus levels were high, and my filtration rate wasn't good. So she was gonna try to do adjustments, but she's like, well, your new kidney will take care of all of that.
Yeah, exactly. So that's good.
Yeah,
and I think that I definitely agree.
Timing's good. And then I've heard from the nephrologist, and I've heard from the different transplant people, and the surgeon said that if you get a kidney before starting dialysis, that you have a much higher success rate with the kidney and like longevity and all that stuff, because when you go through dialysis, dialysis wears your body out because it's pulling fluids out, it's putting pressure, it's causing issues. So the more issues it causes, the more difficult it is to get a kidney. And then how your body is. He actually called my body ripped, and I was like, and then he's like, well, let me see your abdomen. I was like, no, you can't call me ripped and then look at my stomach. Right? You could just call me ripped. We'll leave it there. And then I laid it on the table, and he had to examine where the incision was, and he just pushed it into my fat, and I felt less ripped. Maybe he was thinking of you. He was like, your ripped body. I'm like, no, I am not ripped.
I don't know, maybe he meant ripped like in torn.
Like your
body's
torn
ripped.
up. Pretty ripped up. Yeah, 27. Ripped up. Yeah, that's probably what it was. That's probably what he meant. But I had to see, so I went in, and we were actually a little bit late to my appointment, my pre-op appointment. But when we got there, we got pulled aside by one of the doctors, and she put us in a room, and she asked us if we wanted to be a part of a study. And so what they're going to do is, she explained the study. It's a T-cell study, and I'm going to be one of 12 other patients who are going to be participating in this study out of the University of Kentucky. And they're going to pull out my blood the day before the surgery in a machine, and then they're going to culture my T-cells, and then they're going to take my T-cells and then reimplant them in my body, I believe the day after or the day of the kidney transplant. And the idea is that the T-cells will help the pancreas, the kidney, help the kidney stay stronger, and it'll help last longer. So it'll reduce rejection. And so if this T-cell program works, then the likelihood, there's already probably a really low likelihood for the fact that we're so closely related, because you're my brother. But then on top of using the T-cells, it should, I don't want to say like there'd be no rejection.
Yeah.
But it should help improve those odds of losing the kidney. So that's going to be a 12-month study. They're going to do a biopsy when they put the kidney in. So they're going to take a piece of the kidney and check it. And then they're going to do a biopsy, I believe it was 4 months later. And so And then I got to do regular blood work along with, I'm already going to have to do regular blood work with the kidney just to make sure that I'm balancing correctly with immunosuppressants, because they're going to put me on a bunch of drugs and immunosuppressants to find, to make sure that that kidney doesn't, I don't lose that kidney. Because if my immune system's too strong, it'll kill the kidney. If my immune system's too weak, it'll kill the kidney. So you really want to get in that Goldilocks area. So hopefully with a combination of the T cells and the balance of immunosuppressants, I should be able to keep the kidney. And eventually, hopefully at the end of the 3-month period, they'll titrate me off of the immunosuppressants to a low dose to where I'll stay on that for the rest of my life. And so then they'll do another biopsy 3 months later. And so from what I understand, they're gonna put a needle in my stomach, and then put a bigger needle in my stomach, and take a piece of the kidney. And where they're putting the kidney, because they're gonna attach. The surgeon explained that they're gonna attach the kidney to the artery, and then to the I don't want to say urine output. I'm trying to. We're supposed to be medical professionals, teacher. No. Anyway,
what are you talking about?
Connecting the blood and the urine together, and then they're gonna place it inside of my right hip. And so, like where my hip bone, it's gonna sit and be protected by my right hip bone. And the other 2 kidneys are gonna remain in there. And most likely, what he said will happen is that they'll die and shrivel up, and then it'll just be used on the 1 kidney. But he said that they potentially, all 3 could work. It'd just be a low filtration rate. Like the other 2 kidneys might produce a little urine, but the main powerhouse will be connected to TJ's kidney.
Yeah. And that's where like they were talking about the filtration rate. So like for those scales too, they said like mine measured at like it was like more than 120. So and then the average I think was like 109 to 115 or something like that. So, and that's why, like, even having half of that, like, I'll still be, like, in a pretty good, healthy rate. So, even with that 1 kidney, like, what you're standing at, like, 12 right now, you should be in, like, close to, like, somewhere in the 40s and 70s.
That'll be good.
Yeah, so that's why he was, like, that's why, I guess, Todd was telling me that they kind of prefer just doing, like, living donor, because it has such a high success rate. It's a really minor procedure. And like it also like it adds so much more time to like that person's life too. So it's not just like hey dialysis and hopefully you get for like a few more years, but like this is more like hopefully you'll get like a long term like decade or more years. So,
yeah, it's definitely turning into a courageous brother kidney adventure. It's Jennifer. It's definitely turning into something else. Yeah, if you guys have any questions, please shoot a message, and we'll try to answer them as we talk about this. And if you guys have any questions for TJ on his side of things, if you guys are thinking about being a donor or what it takes, definitely talk to TJ. And if you're not a donor and you're my situation, I have answers too. Oh, did it? So John's took right off. So his kidney just started working like immediately, started going, because they're gonna cath. I think they're cathing both of us, but they're gonna intubate and cath me, and they want. I think I'm supposed to be cathed for 3-4 days. They want the
measure your output.
Yeah, measure my output, and they want me to be empty when they put it in. So they're going to empty me out. Actually, we did get a tattoo. Yeah. So speaking of tattoos, and we really appreciate. Thank you for your prayers. We really do. It means a lot. But I have this. It's Virtue Exalts in the Trial in English. And TJ has it in
Latin.
His in Latin, but it's on the same arm. Yeah. So yeah, we got sharing tattoos. But virtue exalts in the trial is kind of a family motto, and so this kind of is one of those trial moments, and I think we're going through it pretty virtuous.
Yeah. Who knows? We might get kidney tattoos.
Yeah, I was thinking a tattoo. So the kidney disease emblem is a green ribbon. So I was thinking about getting a green ribbon around my calf, like a really cool green ribbon though. So it's like a bow and it's kind of blowing in the wind.
You get like a little kidney bean on your hip.
Oh, kidney bean. Nice. Yeah. Get a kidney bean
just
right
put,
where the
hollow
scar
out
is.
one where.
Well, I was thinking get a kidney with a red circle and a line through it, like no kidney needed.
Oh yeah.
But I mean, but kidney needed. Kidney is needed. So it doesn't really work. It seems like a cool concept, but
it was just fun.
Yeah, it's just fun. It doesn't really work. But yeah, we got those tattoos, and definitely I want to get one afterwards too. And I want to redo my hope one. I don't know, it's very symbolic for me, because when I initially got it, it was just to remind me that, because I pour my medicine into this hand to always have hope. And then as it started fading, it felt like me, because I feel really worn out. And so the tattoo's worn out, I'm worn out. But maybe when I get TJ's kidney in me, I'll get this revitalized. Also be symbolic. Oh yeah? Yeah, she likes your kidney bean idea. Get a kidney bean tattoo. Oh, that's awesome. Yeah, I think I really like the green ribbon idea. And I also thought about getting a blue circle. Blue circle is the international symbol for diabetes. And since everything happened because of diabetes, I thought I should, display that too, own it. That's how it happened. So yeah. But I talked to the surgeon, and then I talked to the anesthesiologist, and they gave us the lowdown. My biggest concern was waking up. I've personally seen people extubate themselves and get intubated, and to me that is a horrifying thing, to be honest. If I woke up with a tube down my throat, I think that would be terrifying. And so that was my first question to her. It's I'm not going to wake up, being intubated. And she's like, no, you should definitely be extubated by then. And she said, if you're concerned about that, because I have seen people wake up in the middle of it. She's like, if you're concerned about it, they'll just give you a little extra to make sure they put you down good. And so I think I might ask for that. But I'm scared of that. I'm concerned. I don't know if I'm super scared.
You'll be okay.
Yeah.
If you freak out, you just put oh, he's waking. Put him back. Put him back down.
But the way I've seen it is when people wake up, it's the first thing is grab that and just rip it out.
Yeah, they start
they panic and they grab it.
Yeah.
And so if they can't get to me in time, I would hope that I would be more breathe through it and relax.
You're gonna have 4 or 5
But
people
waking up with
it.
a tube in my throat.
Yeah, I think you'll be fine.
That doesn't sound fun.
You have so many people. It's definitely really cool because it's a huge team, So you have your own team, I have my team, and we just take it out and put it in. So
yeah.
It's pretty cool.
Yeah. The surgeon was really cool. He was really laid back, and he was really open to answering all of our questions. So that was really helpful. I had questions, but Kayla definitely had a lot more questions, which I appreciate. She keeps me on my toes. She made sure that we got questions answered. So Kayla had my back, because when I'm talking to the doctor, I'm thinking about other things, and she's thinking about the whole picture, and so she definitely helped answer a bunch of questions on my side of things.
Long-term stuff.
Yeah, long-term stuff. What to expect, isolation-wise, because I was under the impression that I needed to be ultra isolated forever. For 3 months, no contact with anybody until they figure out the medications. And what they said is no, it's not quite like that. You need to be really careful when you're when you're on the immunosuppressants, but don't be shut into your house. They want you to get out and do stuff and live your life. Just be careful and cautious about who you shake hands with, and who, if people are sick around you, so make sure you wear a mask at all times. And so for the first 3 months, I'll just be wearing a mask whenever I go outside. But I don't know. I feel like I'd be really paranoid about it, and I wouldn't want to ever go outside.
Extra careful with everything.
Because that's the last thing I want is you to give me one of your kidneys, and then
I think you'll be fine though.
Yeah. You think so?
Yeah.
Do you have any big concerns, man?
No. It's kind of like, I feel like it's all in God's hand and something that I've kind of like decided. I don't think like, a lot of like, things that happen in life for a reason. I feel like God is ultimately in control of everything, and if he didn't want it to happen, he would have stopped it from happening a long time ago, Like, especially with me, like, being in the military, there's so many obstacles alone, and I'm trying to go, like, battlefield, there's so many rigorous, like, physical, like, exams that you have to go through. So it's like going through the whole screening process. I've even tripped up myself, even just over, like, an eye screening exam, and it's postponed things. So, I mean, I feel like if God really didn't want it to happen, like,
it wouldn't happen.
Yeah, like, I mean,
yeah.
Sometimes if simple things, like if you don't have the right range for your blood work and all that stuff, so. And I think like the sheer fact that we've made it this far is, evidence in itself that this is definitely something God wants to happen.
That's awesome, and thank you, Miss Bennett. Definitely having TJ lucked out, happened to have a super fit, healthy, extraordinary kidney brother. Well, I mean, your kidneys are really awesome, which I think that's some kind of reflection on you.
Yeah. Didn't start drinking until 21. That's
Yeah,
probably what it was.
There you go, kids. That's the key to having healthy organs. Don't drink
until
you're 21. My nephrologist said they make sure you get your halo, or when you're done, like
halo.
Yeah, just like you put on your halo. Donation kidney.
I don't know. Yeah.
You don't feel like you're halo worthy?
I don't really feel like it.
It's a big deal, man.
So with so yeah, they made it aware, and since I'm like with active duty, it probably wouldn't have been so easy like to get my approval. But with the reserves, you get constantly in and out, and even right now, like I talked to my flight doc and everything, and he approved. He was like, yeah, you'll be fine. There's actually someone else that's a load master in your unit. So like with his job, he was like, yeah, you'll just be C coded for my job. But he was like, if you wanted to ever go battlefield or do anything like that, I couldn't do anything because it would be like too much stress. That alone is like an automatic disqualifier if you have any like major surgeries. So as for like my current job, like I would be fine doing that. So, but I didn't, and that was something honestly I probably need to look into more because I informed my chain of command. I made them aware that was happening. And I'm just gonna pretty much, and actually this past week they sent me like some paperwork that's sent to get coded and to get like it deniffed for a while. So and that's gonna be like its own problem. It just means you can't fly. So but because it means you're grounded.
So it's not like you're like, hey guys, I'm doing this, and you left. You actually spoke to your commanding officer about everything, right? And got approval?
I like talked it all about, like first I did talk to the flight doc and I made sure everything was good like medically and the med board from it, and then I went through my chain of command, and that's pretty much it. And that's the thing too with like being in the reserves, there's a lot, and especially I guess with my unit, there's a lot of inconsistency, and there's things that are kind of like not as lenient, because as active duty, but it's kind of like up to your responsibility to maintain your qualifications and all that stuff. But
so would it have been more difficult if you were on active duty? Is what you're
probably. I don't know. That's probably another reason why I was good that I'm in the reserves, because like in the reserves there's minimal oversight, or there's like a handful of people, but yeah, and that's something that I'm still gonna have to follow up with. And I told my supervisor and all that, and they're like, yeah, you're good. You gotta do what you gotta do, and like if you need to miss this October UTA, like you'll be fine. So just keep us updated on your stuff, and that was pretty much it. So it really kind of depends on it's really job specific and like and the requirements for it. So thankfully for my job and being in the reserves, like it's not a big deal. If it was active duty, I probably would have had to go through the whole, like go through med board and get RILO'd, and if they would probably just tell me no. But
so from start to finish, how long did it take you to go through the paperwork process and screening and testing and stuff like that?
I mean, it wasn't long at all, I think. So when I came here in July, right?
Is that what it was?
I think so. I think it was July or... Yeah, I think because I started back in March or April. That's when I submitted the paperwork. I did all of like the online forms, and I was coordinating with Todd throughout everything. And then I think I came here in May, or maybe it was July, and through all the testing. And that was just like a whole day of testing. And some of the lab work we coordinated with, coordinated with my healthcare and then the insurance and everything. And so like the 24-hour like urine test, I did that while I was at work and through the lab. So a lot of the lab work I was able to do, like a lot of the pre-lab work I was able to do like on base, and then the other stuff like it was when I came up here, that was like the all day of like testing with any CT scans.
Because they had me do a bunch of testing. What was your testing like? Have they all been supportive?
I mean, yeah. So they've been super supportive. So, and the reserve is definitely a lot easier, I think, to have more control of your own life, and that's kind of why I joined the reserves instead of staying in active duty, because really in active duty you have such like they micromanage everything you do, everything from like taking school to the extra work, and you really have to like get approval for everything you're doing. So you're really closely monitored in active duty, but in the reserves, it's you do 1 week in a month type of thing. You do your obligation or whatever it is, and that's pretty much it. So there's very like minimal oversight, and being in the reserves definitely helped me out with that. And that's probably like I probably would have had like more resistance if I was active duty. So yeah, reserves definitely helped out with not only just being able to have the time to go back and forth, but also just to do the whole process.
Yeah, if any of y'all have questions for TJ, definitely drop them below, or any questions for me. So far it looks like we're still good to go, green, for 25th, right? The 25th. Mm-hmm. So on Tuesday, I'm going in to do some blood work. It's going to take about 4 hours. They're going to pull blood for about 4 hours and then develop those cultures for the T cells. And then Wednesday is surgery day. They won't tell us when we do surgery until the day before. They'll call us and give us a time. Because UK is a level 1 trauma center, their OR is constantly fluctuating time-wise. So they'll let us know the day before if they have an opening or not. Yeah, my insurance is covering all of it. So my TJ has no insurance responsibilities, right? Mm-hmm. Yeah. And on top of that, TJ was also able to get a grant to help him with some things, which the living donor coordinators were able to provide him or help him. They helped you get the grant, right?
Yeah, they told me about it.
So they just told you about it, and then
he was like,
signed up for it?
Yep. So that was pretty much it. And then I got a call about it and get approved. And also like the social worker that was assigned to my case, she was like, or not social worker, I don't know. She was some type of like social or like psychologist. She worked with that aspect of it. And she was the one that told me, hey, yeah, you got approved for it, and he got approved, so you guys are good to go. And she approved. I just called them, and they just send you like credit card in the next day, and it's like a special credit, like a business credit card, and they just fund everything on there for you. So I just call them, tell them like what expenses I'm doing and what I need to be like, what needs to get paid for it, and that's pretty much it. Mm-hmm. So it's made it super easy in booking everything from flights, hotels, and rentals and food, and for not only me but mom and dad too. So
that's awesome. Yeah, that's really cool. I think that's really cool that they did that. Yeah. And my insurance should cover everything, and I think I actually can, because it's a kidney transplant. I might be able to apply for Medicare, and I think Medicare. They said after the transplant's done, we can officially apply for Medicare, and then Medicare should cover everything else. So I should reach. I'm definitely reaching my deductible. I'm pretty sure I've already reached my deductible, and some. And so the way my insurance works is once you hit $6,000 in your overall expenses and your deductible, it's 100% covered after that. So thankfully, you still gotta still got to have the 6,000 to put aside. So.
Mm-hmm.
Yeah, definitely. That definitely helped TJ out a lot in having that existing. And
yeah, it's in a federal grant too, so it's really easy to get approved, and it's something that it's allocated for just these situations that people are in. So it's pretty nice that it exists.
Now, can it fluctuate, like depending? Say if you spent way more than you first anticipated, will they give you more?
Yeah, and that's actually what it did, because originally I wasn't sure who was going to be my caregiver since I'm in Texas. And Todd had made the point where he was like, hey, well, if your mom and dad are going to be coming up here, if they're planning on being there for the surgery, why don't you put them there and then have them cover all their expenses. And so I called the coordinator, and she approved not only my mom, but also my dad. So all of their expenses are being taken care for as well as mine. So it makes it really easy. And the grant is also like good for not just me like right now, but also for like my checkups, because I'm gonna have to be like monitored for like 2 years after this and do follow up and like appointments and everything else. So
it'll cover all that too?
Yeah.
Oh, that's awesome.
Yeah. So if I need to go back to Kentucky for whatever reason to do lab work specifically done in Kentucky, then
they'll bring you up to Kentucky?
Yeah. Because like some of the lab work I flew in for the 19th for the pre-op, like for some reason he couldn't find anywhere in Texas to do it, and the guy that he was coordinating with, I guess it was such a special test that they couldn't find anyone in all of Texas or any place closer.
Yeah.
So it was pretty much a good thing that came in, and we decided to do that.
Yeah, I will say this about UK, Lexington. They've been on it. I put in my paperwork and I got all my tests and appointments done, and within, I think I was 2 months into the UK process, I got a call back, because I applied at Jewish hospital as well. I got a call back from Jewish asking me if I wanted to start. I'm like, I'm already like two months into the process with UK, and they were like, oh, well, I was like, can I apply to you too right now? And they're like, well, if you're with UK, you stay with them. I was like, all right, well, thanks. But UK was on top of it. They got me in to get my tests done. They got me in my paperwork done. They kept checking up on me, and my transplant coordinator has been fantastic. Her name's Christy, and she's just been awesome. She's been all over it. The minute something happens, she calls me right after it. Like when they found out that she had literally just walked out of the room, found out, and gave me a call. Like, she didn't wait at all. Yeah. And then with some of my tests, she was immediately calling me. She's like, I just got the results in. Here they are. She's been on the ball, and she's been really helpful. Yeah. So the teams, I think overall, have just been super outstanding, because the living donor coordinator is also through UK, right? Mm-hmm. And you say you've had a pretty good treatment with them.
Yeah, it's been like just the same. Todd, my coordinator, he's been fantastic as well, and he's been super informative and like really empathetic and like sensitive to the situation and understanding. And like it's really cool because like UK has been excellent in every aspect, from like not only like being like really prompt and like contacting you, but also like giving you that confidence and assurance that, hey, like I'm going on there a knife with like a really good team behind the table. So that gives you like a lot of comfort and like going into this and willingness. So, like, I felt great, and especially like when I was talking to the surgeon, like she was fantastic about it. She's like pretty much like telling me everything, and I was totally cool with it. I felt really safe with having her there and doing it. So, yeah, and I think that's and just like having all the team there, they've been fantastic. So I think it speaks like volumes about the type of industry or healthcare that UK delivers.
Thank you guys. I mean, all of your prayers have been super helpful and encouraging, and we've been hearing from all of y'all, and we really do appreciate it. And I can personally really feel the prayers coming down. I know some people don't necessarily believe in God, but for all those who have been praying for us and sending support our way, we can feel it, because the way things have been lining up, the way things have been happening, I would call it otherworldly, just how everything has come together the way it has. It's it's been definitely something else. It's been overall a really good experience and really encouraging.
Yeah, and just like it really has been like heaven sent, and I think just even the process of being a donor on my end is like really like a really lengthy process, and it's very strict, I guess you can say. Like just the requirements for it. Like not only does it have to be like in really like good health and have a good background, but you also like can't have a criminal background. And it goes into like all aspects of your life, and that's why there's a social worker involved as well. So just like off the back, a lot of people are like automatically like disqualified whether they have like pre-existing medical conditions or like certain background or history of certain things. So I felt like very fortunate just to be able to even do this. So I feel like it's definitely God's been having his hand in all of it.
Yeah. So it's very fortunate that you've been super healthy and super fit.
And pretty safe.
Yeah. I think don't do drugs. Yeah. Don't get into bank robberies.
Yeah.
No, I didn't know that part. I didn't know that they. I kind of thought they were just looking for like somewhat healthy people, but they have a pretty strict criteria on that side of it.
Yeah, and even like the reasons why you do it for, because like, and that's why that social worker gets involved, because they don't want people to be doing it for like unhealthy reasons, especially if you're not mentally healthy. And like say you're trying to like do this to try to make amends with yourself or some type of wrong, and then also for the criminal aspect of it too, it kind of goes to like some type of inhumane aspects. But whether you're getting like people that are in prison like donating their organs, and I think there's a lot of aspects. There's a lot of aspects I didn't even think about, like considering.
So people in prison can't donate?
Yeah.
I mean, if they want to donate, why can't they donate?
I mean, yeah, and that's where I think, like, if you have your consent thing, but also if you look at it from
they
like
worried
a
about
federal standpoint, you're like, or from the outside of it, you're like, okay, are we just going to use prisoners as like, butchers? They're just going to be like
harvest organs,
yeah.
It's like a liability issue.
Yeah, because I mean, they could do it, and that's another thing too. Like, you can't get any money from doing this at all. So like, there could be a number of reasons why they could get into a lot of problems. But yeah, so there's a lot into it.
So do they put you in a test or something like that? Do they give you like some written exam to determine if you were mentally where you needed to be in order to do this?
Yeah, I mean, you have like the psychologist or the social worker. She like evaluates you, and you fill out like this little. It's like a test, like it's a questionnaire and yes/no questions, and she gets like a history of like your emotional and mental state and all that. So,
hey, thanks, Jennifer. Yeah. Please do keep us in your prayers. Mm-hmm. The surgery is gonna be 4 hours each. So 4 hours for TJ, then they put his kidney on ice, and then 4 hours hooking me up to it, and then we spend 3 days in ICU. How long do you spend in ICU?
I'm not sure, because I haven't even talked to the anesthesiologist. They're supposed to call me.
Oh.
So,
yeah. Okay. So yeah.
I'm just speaking of which, I don't know.
Hey, thanks, Mary. Yeah, I miss you guys too. I miss the old yellow days when we all got together in your office and hung out. Those were some good times, good memories. I don't know. When I look back at the days at Yellow Ambulance, some of it was good, some of it was bad, but mostly good. It was because of the people. A lot of people. No offense to command staff, but some of the command staff were kind of I don't know. Anyway, I won't get political about any of this. Thank you is what I want to say. Thank you, and I had a lot of fun with you too. And I still have that shirt you got us, except the Yellow Ambulance is wearing off on it. So it just says EMS on the back, but I still have that shirt. So yeah, I definitely miss the people from Yellow. Those were some good times. Everyone's all grown up now too. Like all the people I knew from Yellow Ambulance, they're all paramedics now, or working different services, and so I'm still EMT doing the thing. Yeah.
Life isn't simple.
No, it's not. Well, if we'll stay on for like a minute more, and if no one else has any other questions, then we'll sign off here. But yeah, if you have any questions for TJ or I, or if you want to say something, words of encouragement. We appreciate those too, and everyone has been encouraging on here so far, and we really do appreciate all that. Thank you guys for being encouraging and praying for us and supporting us. So we still got a couple days left to go, and it's going to be this Wednesday, the 25th. We're not sure what time. Yeah, the paycheck days were pretty good. Yeah, Mary, those were fun days. When I was at Yellow payday, Mary would turn on music. We had this spot that was next to it, and we would drop our runs, and then she would check our runs just to make sure we did them right. But she'd also have checks, and so she would turn on music and we would dance, and we had a good time. And she would hand out checks to everybody.
Oh, that's cool.
Yeah, it was fun. It was fun. But yeah, if you guys have anything you want to ask us or say, we'll be here. Give it one more minute here. A minute should be enough time for anyone to type up a question. But yeah, Wednesday is the day, and then we'll be in the hospital till probably my birthday. My birthday is October 1st. Mm-hmm. So it's a great birthday present, TJ.
Right.
It's a present I can never repay you. It's never a present I could give back, or try to do one better. Yeah. Aside from jumping in front of a bullet for you, I can't do anything.
You do the same for me. So.
But I can't though.
You would.
I would, but I can't. I would like to, but I could still jump in front of a bullet for you, but I can't give you one of my organs because they're all crap.
It's fine, man.
Hey, thanks, Tim. Yeah, we appreciate it. Yeah, TJ's a pretty cool guy. It's a pretty big thing too, man. It's a big ask, man. It's a really big ask.
No, I don't think you really asked. So I kind of volunteered for everything. So I just prayed about it.
Yeah.
And it's been leading me this far in faith. So I'm excited to see what the future has for me and everything else. Yeah, I think it's very humbling for me too. So I think God's showing me a lot and teaching me a lot through it.
Would you encourage other people to try to do this?
I think if you could. So yeah. Totally, and especially if it helps someone else out.
What were some fears, by the way? Any kind of fears?
I don't think I had any fears. Yeah, because
could you think of some common fears that some people might go through that you could think of?
I think of the repercussions of donating. Of what your life's gonna be like in 5-10 years, and your health situation. Are you gonna be able to do the same things you want to do? And that was a big thing for me too. Because I was so gun ho about always doing battlefield stuff. And now, I'll probably never get the chance to do that. So, but, that's, I think, what consequences or what sacrifices you're willing to make, not only just in your health, but also in your lifestyle and also, your career path and everything else. So I think that's probably, the hardest thing, is figuring out, what way it's going to affect your life afterwards. And that's something that you just pray about and you go with. But, yeah, I think, and also, if God doesn't want you to do it, then he probably would stop you from doing it. So.
Yeah. But, so you believe firmly that he would put you in a different direction if he wanted you to?
Yeah, I think so.
I guess he has done that, and
That's what he's done for me, for the whole battlefield thing too. Because I've had numerous times that I had been doing what I was doing before, then I probably wouldn't be here right now. So, in the grand scheme of things, one little decision or one choice can, definitely change the outcome of, your direction in life. So, I think, I've seen time and time again God, kind of push you another way. So you just have to have the humility to go with it. So.
Yeah. Well, on that note, thank you all for tuning in. We really appreciate you guys sticking out with us and praying for us and asking questions and getting involved. And if there's anything that you would like to know or
I agree. Yeah, definitely. You know, I was talking to one of my friends, coworkers, about it. He's like, man, because he was also like he was a PJ trainee and stuff, and he was like, dude, now you get to live up to that model. And I'm like, you're right. So I guess that's one way of looking at it. So, but it's humbling. Yeah.
Sacrifice. Or?
Yeah. So I mean, because that's their motto. You know, these things we do that others may live. So and it's like the thing that you say you do your whole creed in the morning and before you know when you go and when you leave. You know.
Yeah, man.
But it's humbling, and I think it's, especially for me, because you know that's like the pinnacle of what I've always thought, you know, and I think God's pointing me in, obviously in a different direction, so it's been good.
Sacrificing your body.
Yeah, well, I'm sacrificing my kidney.
So,
hopefully I'm not gonna die on the table.
Yeah, me too. I don't hope I die usually either.
We'll be good.
Yeah, we should be good. I mean, you're a healthy 20-something. I'll be, you know, somewhat of a healthy 20-something after your kidney, so.
It'll be good. So.
Yeah. Thanks, Jennifer. Yeah, really thank you for your support, and yeah, it's really something else. Anyway, we're gonna sign off here. If you have any more questions for us or anything like that, post them in the comments or leave a comment on the page, or post something on the page, and we'll be more than happy to answer it or do something. So I'm gonna try to put out some more video and footage the day before and of surgery. I'm not sure how much I'm allowed to do because it's in a hospital, so I'm not sure if they're going to worry about HIPAA violations or anything like that. Although it's my information, it's my medical information. I'm allowed to share it, so that's not a HIPAA violation. It is a HIPAA violation if they shared it with you without me letting them.
They say like no one owns their medical records.
Is that what they say?
Yeah.
Because it's my information.
It's not yours.
But it's mine.
It's not. It may be
well,
about
anyway,
you.
yeah, it's about me, which is mine.
Yeah,
that's logical, right?
I mean,
that's
the
the way I always understood HIPAA is that you can't share it with anybody outside of what was going on or outside of who you were speaking with.
Yeah.
So if you and I were both there on scene, then we could talk about that specific thing. Yeah. But if you weren't there while I was, you know, performing patient care, then I can't tell you anything about it. I could talk to the patient about it because he was there.
Yeah.
But
like when it comes specifically to your medical record,
so, like, that's another debate for another time.
Yeah.
But we don't know how much video we'll be able to take or what we'll be able to shoot, and so I'm gonna try to sneak my camera in and get some video of the process beforehand, and then I'll be in the ICU, so I think it'll be definitely hard to get a camera in there. So we'll be in the ICU. So
yeah, probably a different one. So,
yeah, it'll probably be difficult to get that information in there, but thank you all. Please continue to keep us in your prayers. Love you guys. Bye.
Bye.